I'd like to talk about sheath-guided orbital triamcinolone injection, a new method of triamcinolone injection for thyroid eye disease. Beneficial effects of orbital steroid injection for thyroid eye disease have been reported. However, these techniques still have room for improvement, and a method was developed to penetrate steroids more deeply into the orbit. We evaluated the efficacy of a new method of triamcinolone injection, sheath-guided orbital triamcinolone injection, SG-OTI, for TED. This is a retrospective cohort study. Included patients diagnosed with TED who underwent SG-OTI. The inclusion criteria were a clinical activity score of over 2 and local inflammation of the extraocular muscles. The exclusion criteria were more severe TED and needed intravenous steroid pulse injection. We evaluated the effects after 1 month. Next is preparation before injection. Cutting the root of the sheath. 24 gauge, 3/4, 19 millimeter needle. And inserting the needle into the sheath. This product of triamcinolone acetonide 40 is used in Japan as shown in the video. It can be used as Kenalog 40 in the USA. Next is the procedure. Puncturing the orbital septum with a 24 gauge, 3/4, 19 millimeter needle. Indwelling sheath of this needle. A 27 gauge, 40 millimeter dole needle was advanced. A total of 1 milliliter triamcinolone acetonide was injected. Here is the video. We inject in 2 upper eyelids and 2 lower eyelids, respectively. We analyzed 23 eyes of 12 patients. The mean age is 50.2 years. CAS decreased from 6.0 to 2.5. Proptosis decreased from 24.2 to 22.1 millimeters. The coronal maximum area of all extraocular muscles decreased after 4 weeks. We assessed the degree of inflammation of the external ocular muscles with a relative intensity ratio. The relative intensity ratio decreased after 4 weeks. SG-OTI is effective for TED and can decrease the area and RSI of the extraocular muscles and improve proptosis. This new method, SG-OTI, can have more selective and effective effects for extraocular muscles than existing local steroid injections in TED. Thank you for your attention.